Besides that, now there is also available of artificial heart, and worldwide more than 1,000 artificial heart are already being implanted. Certain blood group, the availability of heart is less, like anybody who is AB negative, very less chance to get the heart. The immunosuppressive drugs, because we have transplanted, that patient must take immunosuppressive drugs for whole of the life. Destination therapy, where VAD is a therapy for lifelong. Worldwide, the incidence of heart failure is on the rise, and same is true for our country. The heart failure may be because of various reasons. Some of important reasons are terminal coronary artery disease, heart valve problems, dilated cardiomyopathy, viral infection, cardiac amyloidosis, and likewise. Now, if a patient who reaches to the stage of terminal heart failure, in spite of medications, if he did not get appropriate relief, then one has to look for some other alternatives. Besides medications, there are 3 other important alternatives which are available at this stage in our country. Either we can do resynchronization therapy, which is known as pacemaker implantation, which gives some relief to these terminally ill heart failure patients. If they don't get relief, then we consider them putting a VAD, which is ventricular assist device. This can be LVAD, can be RVAD, or can be BiVAD. Now, these VADs can be put in 3 modes. 1, bridge to recovery, where some of the patients, particularly viral myocarditis and postpartum myocarditis, patient, they go into the heart failure, but there is a chance of recovery. If we put the LVAD, RVAD or BiVAD in these cases, once they recover, then we remove that VAD and patient's life become normal. So this is known as bridge to recovery. Then there is a bridge to transplant. The patients who are waiting for transplant, if they deteriorate very fast, then we put the LVAD, RVAD or BiVAD and temporarily keep their heart working. This is known as bridge to transplant. And the third mode of implantation of VAD is a destination therapy, where VAD is a therapy for lifelong. The VAD can work 5 years, 10 years, 12 years, not beyond that. Besides VAD, now there is also available of artificial heart, and worldwide more than 1,000 artificial heart are already being implanted. But with artificial heart, patient has survived not more than 1 to 2 years. So eventually, the best mode of therapy for terminally ill heart failure patient is heart transplantation. Can every patient with heart failure be given the treatment therapy in form of heart transplantation? Not really. There is some age restriction in our country. Anybody who is more than 65 is not considered for heart transplantation. Now if the patient has got so many other problems like severe form of diabetes, renal failure, cancer, hepatic failure, poor LV functions, accompanied with lung problems. So these are not a candidate which are being chosen for heart transplantation. So we have to carefully monitor the patient, examine other systems. If there are not many major problems in other system, then we consider a patient for heart transplantation. Now, heart transplant criteria, besides the clinical patient's condition, there are certain preliminary examination, what we call as a pre-operative assessment of a patient, which includes assessment of renal function, hepatic function, lung function, some humoral functions. Normally we do panel reactive antibodies, PRA, which is very important, and this gives us the sensitization of individual, and the certain level of PRA, if it goes beyond, then patients usually may not be accepted for transplant because then the rejection is very high. Patient who has got a very high panel reactive antibodies. Now, blood group is again very important. Both ABO and RS system to choose a specific donor for that blood group which is the recipient has got. So certain blood group, the availability of heart is less, like anybody who is AB negative, very less chance to get the heart. But if the patient is O positive, there is more chances because this population comprises of around 60 to 65%. So these are some of the preliminary test, examination and assessment of a patient for heart transplantation. Now we also assess the patient's socioeconomic status because patient has to take the immunosuppressive drugs because we have transplanted, that patient must take immunosuppressive drugs for whole of the life. So viral assessment is also very important. Now eventually these patients who are being transplanted, they take steroids, they immunosuppression, and because of steroid there is chances that they may develop eventually a severe form of coronary artery disease, or they may get a viral infection, or the chances of acquiring infection is very high. So these group of patients who has already been transplanted, besides that they have to take a lifelong immunosuppressive drugs, they should also take care of their routine life so that they may not get infected because of virus or bacteria. So in nutshell, not only that every candidate is not for heart transplant, we have rigorously investigate the case. Even after heart transplant, patient must be very attentive to lead a very regulated life to have a very good long-term outcome of heart transplantation.
If you found this video helpful, don't forget to give it a thumbs up and share it with your friends and leave your thoughts in the comments below. And of course, subscribe for more content on health and lifestyle.